One of the biggest mistakes I have seen physicians make with their patients as it relates to death and dying is, number one, being too aggressive. And sometimes, in my opinion, when the patient cannot be cured of their disease, the physician pursues a very aggressive course. And I'm not sure exactly why that is, but I suspect that physicians, number one, are taught to be aggressive and to eliminate every illness and treat it till the end. But I also think that it has to do with, somewhat with a fear of discussing death and dying. It's an uncomfortable topic. Many physicians don't have much experience in medical school with that topic or being taught a lot about how to ask questions and deal with it. If I were teaching young medical students or physicians about dealing with death and dying, I would tell them to think that they're not a physician. Take away all their medical education and put themselves in the shoes of the dying patient, or put your brother or put your mother or father in their shoes. And that way you can attach your emotions to it, and I would be guided by your emotions. And I think you would come to a different conclusion, that you could feel the suffering, the potential suffering, and I think you could make a wiser decision that way. I think that physicians today who are coming out of medical school probably deal with this better. Palliative care was not available when I was in medical school. Hospice was rarely mentioned. So I think we're moving in the right direction, educating our physicians. But again, I think there's a long way to go, and I think actually hiring actors and having these one-on-one sessions, probably in a medical school setting, is good, but more I think the person has to try to reflect that if they're the dying patient, and that really gets them in touch much better with how to act.